Good morning, everyone. First and foremost, I want to thank the people that organize Iraps and allowing me to do my presentation in a video format. I had some mix-up on dates and I'm not able to attend the conference. I'm super looking forward to attending next year, as it's something that I've always wanted to go to, just never really had the chance when I was in school to go to. First and foremost, I want to introduce myself. I'm Dr. Mike Merkt, owner and operator of the Specific Chiropractic Centers here in Lake Country, Wisconsin. It's about 30 minutes west of Milwaukee, Wisconsin. Been in practice for a little over 2 years now. Did my schooling at Northwestern Health Sciences University, and I'm sure some of you guys are like, whoa, like Northwestern and chiropractic, and that's not usually the best fit. But there actually is a really great philosophy club there. There's some really great mentors in the area, and that's really what kind of brings me here today and with all of you guys. So in my chiropractic journey, started out with activator, got into MC2 and tonal work, and then that brought me to upper cervical specific, and more importantly, the art of the specific. The art of the specific is knee, chest, upper cervical, analysis via thermography and x-ray, and then the adjustment done in the knee chest position. But what I really want to cover today is the effect of upper cervical specific analysis and procedure on children with anxiety. And I'm sure a lot of you guys understand how kids with anxiety, autism, ADD, ADHD can be helped with chiropractic, especially when we address the subluxation component and all of that stuff, and how their nervous system is usually out of whack. But I think this case that I'm presenting is a little bit more unique than most, and it all ties back really to his history. So before we get into it, some stuff I want to go over. What research has shown us, what statistics have shown us, is that 6.4 million kids have been diagnosed with ADHD as of 2011, and another 9 million have some sort of anxiety disorder going on. Those are crazy numbers. And I mean, I realize those go hand in hand, but that's still insane, and we got to realize that's like the future of our country. And a lot of these kids, when they come in my office, I think they feel like they're the only ones that suffer with this sort of problem, when that's obviously not the case. Now, what some other research is showing us is that the autonomic nervous system plays a pretty large role in some of this anxiety stuff, not only with kids, but also with adults and also with other mental health stuff. They're showing that a lot of times these people and these kids have some sort of autonomic misbalance going on, which can definitely play into this anxiety, this ADD, this ADHD, because we have to remember that the nervous system is really like a giant sponge taking in tons and tons of information every single second. And if that's not really working how it's supposed to work, well, maybe we're conscious of a little bit too much information, or maybe not enough information. And well, suddenly that can look like ADD, ADHD, that can look like anxiety, it can look like OCD, it can look like all of these different things going on, it can look like depression. And really what I've found is that, man, a lot of these people, they'll have a pretty messed up nervous system. We use thermography, we'll get into that later, to really determine how the nervous system is functioning and the integrity of it. But I think it's really important to realize that the chiropractic and subluxation is a lot more than just pain and headaches and all that stuff, but it really changes people's lives as a whole. And the better we can get at detecting that, and as the profession, the better we can get at detecting it, the better humanity is going to be. Okay, the patient, Caleb, he's a 10-year-old boy. He came in initially with anxiety, ADD, ADHD, depression, food sensitivities, tic disorders, and then walking on his toes as well. And some unique things about Caleb, but first, I want you guys to meet him personally in this video that I did a few months ago with him. We have a very special guest by the name of Kyle, Callie, Katie, Chris...
Caleb!
Oh, Caleb! Caleb, a special guest by the name of Caleb. So Caleb is 10 years old. He's an amazing athlete. He's been coming here for, how long has he been coming here?
A couple months.
For about a couple months. And you want to share a little bit more about kind of what you've experienced coming to the specific and stuff like that?
Yeah, sure. So, basically, I was going through a lot of emotional, I was in a really bad place before I came here. It wasn't specifically that I was sore, my emotions were just a little off and I was in kind of a bad place. And then I started coming here. My mom said, hey, I found someone that could help you. And it was Dr. Mike. So the first day I came here, he basically told us what it's all about. And then after about a week coming here, I already felt so much better. And I found a huge change in how I was feeling emotionally.
Yeah, I mean, I remember kind of like your fourth or fifth visit. You came in and you're like, hey, Dr. Mike, does this have anything to do with stress? I'm like, yeah, why? And you're like, because things that used to set me off to a 10 are now like a 2 now.
Yeah.
And I know that used to be like a huge perfectionist to where it would like ruin like games for you, is that right?
Yeah, I would get so frustrated over the littlest things.
Gotcha.
And I couldn't have fun. And it was to the point where sometimes if I did something bad in a sport, people who were with me had to like hold their breath because they were scared that I was going to get mad. And it kind of felt bad that was the case, so I wanted to get some help and I started coming here and it was so much better.
Yeah, I mean, so much better. You can golf now.
Yeah, I don't even
trying to get mad.
Right, like before I would get mad if I dropped a pass and get my catch. Now, I mean, I still get frustrated in golf, but like everyone. But I think I might even be better than a lot of people in golf now, because I get frustrated and then I get over it in like 2 seconds.
That's awesome. That's awesome. So
over like a week.
What do you like? Okay, so what's really interesting about Caleb, and I hope you guys enjoyed that video. I know it's one of my favorites. He's still one of my favorite clients that comes in. But what's really interesting about him is that his nutrition has been spot on for a long time. And I know that's a big topic when we're talking about neurodevelopmental disorders with the whole leaky gut, leaky brain and stuff like that. But his family actually owns a really large nutrition and supplement company. Another thing that's interesting about him is that he had been seeing chiropractors and being adjusted since birth. So if he's been being adjusted since birth, why do we have all this stuff going on? So I met his mom. She came into my office as a medical or as a sales rep for her nutrition company. I told her, hey, that's really great. Nutrition plays a huge role in our health, but that's something that I don't do as an upper cervical specific chiropractor. She ended up coming to a workshop that I hold called Unraveling Neurodevelopmental and Behavioral Disorders, and really learned a lot more about how the nervous system is really tied into all of this stuff going on. First thing we did, we got him in for initial testing. In my office and all the specifics and everyone that does the art of the specific, what that really initial testing looks like is we do some scans. I do some scans of the neck, some full spine scans, and then an x-ray analysis as well. So with the x-ray analysis, that really tells us what needs to be adjusted and how the adjustment or correction needs to take place. Well, when we do that, we do a lateral view, APOM, tilting to the right, then tilting to the left, and then a base posterior coming underneath. The reason we have the person go to the right and to the left is we're not really doing line drawing or anything like that. Rather, we're assessing the biomechanics of the spine. And are these top two bones moving how they're supposed to, or are they getting hung up in some certain way? Now, once we do that, we come up with the listing. For Caleb, what we came up with is a body left listing. And then from there, it came down to the scans. And I want to share with you guys a quote from B.J. Palmer. Volume 25, Clinical Controlled Research. It's on page 633. And what he says is, essential issue is that you must adjust only when there is interference. You must not adjust when there is no interference. You must know when you have given an adjustment, releasing pressure. That presence of a kink or twist of a vertebrae, as revealed by spinograph, is not sole or only guide to follow in giving an adjustment. If it were, you would adjust atlas or axis and many other places every day and be right back to general adjusting, Merrick system, majors and minors, without added improvement or step up in efficiency. There is no other way this information as to existence or absence of interference and when present or absent can be ascertained except by competent, efficient, honest use of neurokilometer. And with that quote, that's why I said the x-ray portion, that tells us what needs to be adjusted and how it needs to be adjusted. But I think what a lot of the other chiropractors were missing, in Caleb's case especially, is when that adjustment needs to happen. Now, obviously, me being an upper cervical practitioner, I do believe that the upper cervical component is the most important component in the spine. I only work with those two bones. I'm not one of those upper cervical docs that works with those bones and then something else if someone else thinks they need that. It is only those two bones. But really, when it comes down to it, the most important part is the nervous system and the scans that we use. In my office, I use a Titron C5000. What that does is that gives me a pattern that the nervous system is in, and from there we determine pattern analysis, and we determine a pattern that we adjust off on subsequent visits. Caleb came in, we gave him his first adjustment, and I mean, usually when I give someone their first adjustment, I always tell them one of three things can happen: that they can feel the same, they can feel better, and that they can feel worse. Now, what was interesting with him is during his next visit. So after the first visit, his mom came in and said that she had already noticed a change. After 3 visits, Caleb came in, and like you heard in the video, he was asking me if it had anything to do with stress, because he noticed that he wasn't as stressed or didn't feel as really triggered as he used to. And from there, after 3 adjustments, and this is 3 adjustments after 6 visits. There were visits in there where he didn't need to be adjusted based on the thermography. His mom came in and told us that he wasn't walking on his toes anymore. And that's a pretty big deal. So with all that, with the thermography, we use thermography, like I said, to measure the nervous system. Dr. Christopher Kent came out with some awesome research that talked about that, on how using skin temperature differentials can be a great measure of the autonomic nervous system and autonomic dysfunction. So let's show you guys some of the scans and really the way that we use it. So this scan right here, this would be when a person first comes in, when he first came in. As you can see, we're not super centered. We want to be centered on that blue line. This indicated with the pattern that we selected that he needed to be adjusted. We adjusted him. From there, we rested him for 20 minutes. Right behind me, I have a room with 3 zero gravity chairs. That allows the body to really process the adjustment, make it so we don't have to keep adjusting over and over again, as it's really my goal to not adjust people, because that means the body's working how it's supposed to. And then this is his scan 20 minutes later. So as you can tell by this, we do see an immediate effect in the nervous system following an adjustment. I think that is really cool, and it has had a huge impact on Caleb, as you saw by that video we showed earlier. Now, something that I think is really cool and really beneficial for the profession as a whole in regards to moving it forward is with the art of the specific and the technique that we do and everything that we incorporate into it with the scans, with the x-rays, is it's 100% reproducible. Meaning that I can show my x-rays to someone else that does the art of the specific, and they're going to come up with the same listing. We can look at the scans and they'll be able to tell when we need to adjust, and more importantly, when we don't need to adjust, because I believe that's what the problem was with Caleb in the beginning in regards to all the other chiropractors he's seen. He would just keep getting adjusted. They weren't 100% sure on where the adjustment needed to happen. They certainly weren't 100% sure on when the adjustment needed to happen, and I believe he was getting over-adjusted, and I think that happens in a lot more people in this nation than we want to admit. And that's something that's really near and dear to my heart. That's why I want to keep on pushing the profession forward. I want to keep on doing this research. I want to come back to Iraps every single year and present on a different topic or a different case study or whatever really the subject is that we're supposed to present on. I want to help move this profession forward. I want to help with the research. And I believe with this case study, we can really prove that knee, chest, upper cervical specific chiropractic does have an effect on children with anxiety, and I have a bunch more cases in my office that also proves this as well. So with that, I want to thank you guys so much for watching. Thank you guys for coming to Iraps. Like I said, I'm really sorry I can't be there. I look forward to coming next year and meeting all of you. I know some of you guys in the audience. Dr. Shondil, thank you so much for giving up your time and standing at the podium and pressing play on this video and answering any potential questions that might come up when we're finished. If anyone has any questions as to really more about this presentation, they want to know more about me, what I do, feel free to reach out to me, Mike at thespecific.com. You can reach me on Facebook as well. It's just Mike Merkt. If you want to learn more about the art of the specific and knee, chest, upper cervical, head to artofthespecific.com. I'll have all those links in the slide following this one. Take care.